Hi everybody, I am Dr. Sarah Wooten and this is all about cats, and in this video we are going to be talking about the top 10 cat emergencies, i.e. if you see this, you go to the vet. You do not wait, you do not pass go, you do not collect $200, you go to the vet. Because if you don't, the problem will probably get worse and more expensive at the very least, and at the very worst, your cat could die. And somewhere in between that, your cat's suffering, right? So let's get into the list. Okay, the number one reason why you want to take your cat to the veterinarian is if they are having unproductive retching or unproductive vomiting, right? So they go to vomit over and over and over again and nothing comes out. So you want to take your cat to the veterinarian if they're vomiting anyways, but if they're vomiting and nothing's coming out, then you really want to take them. Couple of reasons. Unproductive retching can be confused with coughing, which is also one of my top 10 reasons why you need to take your cat to the vet, but it's also associated with severe disease, right? Either gastrointestinal disease or neurological disease or liver disease or kidney disease. It's not good. One of the common things is if a cat swallows a string and then it gets all tangled up in their guts, that can cause unproductive vomiting. So if you see that in your cat, you call your veterinarian and you take them immediately. The number two reason that you want to take your cat to the veterinarian is unproductive urination or can't pee. Very, very, very dangerous in cats. So this looks like when a cat goes to posture in their litter box, but nothing comes out. And then they keep doing it and nothing comes out. And they keep doing it and nothing comes out. You see that? You take them to the veterinarian because they could have a blockage in their urinary system that is preventing them from being able to pee. And the kidneys don't stop making urine. If a cat can't pee, it will continue to make more urine and more urine and more urine until the bladder gets so big and so hard, and in some cases it can rupture. It's terrible, it's painful, but you can avoid all of it if you ever see your cat, especially a male cat, because they seem to have more problems with this than female cats. But if you see them in the litter box and nothing's coming out, go to the vet. The number three reason to take your cat to the veterinarian is difficulty breathing. So cats, they don't tend to cough when they have problems with their respiratory tract. Sometimes they do, but more often than that, they're hiding it. They are not wanting you to see that they can't breathe. So it can be a little tricky to know if your cat is having difficulty breathing. A couple of hints are coughing. If you do notice coughing, call your vet. Other things would be a decreased energy level, right? That seems super vague, but especially if your cat is sitting on their elbows and has kind of their head and neck like extended that way, they're really trying to catch their breath. And that is the most optimum position for them to be able to take the biggest breath. They usually will not lay down. Sometimes they can be restless, but if you see that, you want to call your veterinarian. Also, if their gums are blue, not a good thing. That means that the oxygen is not getting to the tissues and your cat is compromised. Cardiovascular or respiratory. Could be either. But if you see difficulty breathing, don't wait. Get them to a veterinarian ASAP. The number four reason to take your cat to the vet immediately is if their back legs are suddenly paralyzed. Back leg or legs. So cats can get a condition called a saddle thrombus, which is a big blood clot that can cause paralysis and severe pain of one or both of their rear legs. They can also have disc disease in their spine, just like dogs, but it's much less common. It's more common that they might have a problem with a saddle thrombus. This is particularly common in cats with heart disease or cats with hyperthyroidism. It can also be common in cats with kidney disease. A lot of cats in this particular group. So if you ever notice that your cat is not walking on their legs, dragging their legs, not walking on one of their legs, yelling in pain, go to the vet, because your veterinarian will need to treat that to get your cat's leg function back. The number 5 reason that you need to take your cat to the veterinarian either that day or at the very latest the next day is if they refuse to eat for longer than 1 day. Now, cats can go several days without eating, but if they go more than 3 to 5 days without eating, they can develop hepatic lipidosis. That is my fancy doctor word for fatty liver syndrome. It's a terrible design. I don't know why cats evolved this way, but they have to eat on a regular basis. Otherwise, their liver will get fatty, and that is a life-threatening situation. So if you notice your cat not eating longer for 1 day, you call your vet and you take them that day or the next day at the latest. And the reason being is sometimes owners will not notice that their cats aren't eating for several days. It can go unnoticed because cats are sneaky, right? Or maybe they've been consuming less than calories than they should have, and that can add up over time to fatty liver syndrome as well. So to be on the safe side, I say 1 day, 1 day. And you have a grace period of 1 day beyond that to get them in if you cannot absolutely get them in that day. But they need to get in, they need to be, the food needs to be going, we need to figure out why they're not eating, things like that. So if you notice that, you know what to do. The number 6 reason to call your vet and go immediately, don't wait, no wait and see here, my friends. Well, at least call them immediately, is if you know that your cat has eaten a toxin or a poison, or if they've ingested some string. So string, tinsel, hair bands. I've had patients that love to eat their owner's hair bands, and then they would get all wrapped up in their intestines and cause problems and have to be surgically removed. String, it can wrap around the base of their tongue and then go down their esophagus and then cause their guts to literally turn into an accordion, and the gut can be lacerated. It's terribly painful. So if you know your cat ate a string, you call your vet immediately and be prepared to go in and have x-rays taken. If you know your cat has eaten a toxin, we're talking xylitol, ibuprofen, Tylenol, any other prescription medications, rat bait, did I say xylitol, weed, chocolate is also not good for cats, grapes, raisins, garlic, onions, lots of things, right? You can go on the ASPCA website for a list of known toxins, but if you know that they ate it, call your vet immediately. You may not necessarily have to go in. You might be able to treat your cat at home, but at least get your veterinary team involved so that they know and they can best advise you. So that is my number 6 thing, to call or go to your vet immediately. The number 7 cause for going to the veterinarian, haha, we have many of them, is an abscess. So cats like to bite and scratch each other, right? So they'll tend to have abscesses in a couple of places, usually around their face or around their tail. And I like to joke that the winners of the fight have the problems, the bite wounds on the face, because you know, they were going ahead, and then the losers have it on their tail because they were running away as they got swiped. So what happens is when these cats fight, they develop a local infection that develops pus, and then sometimes it opens and drains and other times it doesn't. But if you notice a big swelling on your cat, especially if it's red or warm or has any kind of oozing pus out of it, that's an abscess, and you gotta go to the vet and get some antibiotics. If it's not draining already, they'll need to lance it. But abscesses are very painful. They give your cat a fever. They make them feel really bad. So you need to get them treated as soon as possible. Okay, the number 8 reason to take your cat to the vet. These ones might seem self-explanatory, but if they are unconscious, very depressed, or having seizures. I put these guys all together because these are kind of more of your neurological changes. Depressed, unconscious, seizures. Also, if you ever see your cat unconscious and doing this thing where they put their legs out straight and they put their head back. That's called opistotness. And that is a severe brain swelling that needs treatment immediately. So the other ones, unconscious, very depressed, and seizures. So seizures are rare in cats. So if you see them, you need to get veterinary attention. They can be fatal if they don't stop. If your cat is unconscious, obviously you're going to want to get to the veterinarian as soon as possible. You're going to want to call them on the way so that you know what to do. If they're very depressed, that's another reason to go into the veterinarian, because again, remember, cats are masters at hiding illness. And some illnesses, if they go too long, the cat just becomes very, very depressed. And these cats just kind of have a glazed look on their eyes and they move their head really slowly back and forth. It's almost like they're not there. I've seen cats in severe kidney failure or fatty liver syndrome come in looking like this. So you see those, your cat needs veterinary attention, go to the vet immediately. Okay, the number 9 reason is any kind of trauma or broken bones. This might seem, again, self-explanatory, but there are some thoughts out there that cats can heal themselves. And while they are very good healers, they don't tend to put their bones back together quite as well as, say, an orthopedic surgeon would, right? So if your cat is broken, their pelvis, or if you notice any kind of laceration or anything that's not bleeding or any bones that are broken, go to the veterinarian immediately, seek emergency treatment, get your cat the care that they need. And then the last reason to go to a veterinarian immediately is a swollen eye or sudden blindness. So these are kind of your eye emergencies. So an eye is a very sensitive, precise device in our heads. And if we don't get some of these acute ocular emergencies, is what we call them, treated immediately, then your cat can lose that eye and lose sight in that eye. So if you notice an eye that is red or swollen, like it looks bigger than it should, or if they're squinting, like, and they just won't open it up, those are reasons to go to the veterinarian. A, because you don't want your cat to lose their eyesight in that eye, but also a lot of these ocular diseases are very painful. Corneal ulcers are very painful. If you've ever had one, you know. So eye emergencies. Also, if your cat suddenly does not seem to be able to see, that's a really important thing to go as well, because they can blow their retinas, which is the part of the back of the eye, off due to different diseases, and they can we can sometimes get these cats' vision back if we get them treated soon enough. So that's my number 10 reason to go to the veterinarian. All right, guys, I think we have covered literally every scary thing, from vomiting to not peeing to paralysis to seizures to ocular emergencies. Oh my gosh, so much, right? But knowledge is power. So you might be able to save your cat's life in the future by knowing the things that you learned today. So if you found this video helpful, please leave me a little like or a comment or something down below. You can also share this with your friends. Maybe you'll save their cat's life as well. And that's about it. That's all I have. Make sure to subscribe to this channel so that you can get all of the veterinary advice that I'm bringing you. And I will see you guys again soon.